Welcome, friends. I am Dr. V.K. Chauhan, homeopathic physician, and we are revising homeopathic materia medica from Allen's keynote and characteristics. Here we are dealing with remedy number 179, Thuja Occidentalis. And friends, this is the book which we are going to follow. And if you go through this particular book, Allen's keynote, you have to have the idea or background that it is based on Hering's guiding symptoms. The text in Allen's keynote, here the symptoms are given in running text and there are no grades are given. Each sentence represents a PQR. The drawback or limitation of this work being this text is disorganized in sequence and continuity. However, if you go through the text, you will find Allen's keynote has a Thuja Occidentalis totally covered with 34 PQRs or sentences, or you can say 34 ideas. We are going to take up the next slide, which is going to deal with fifth sentence in the text. And this is the total text which you will encounter, whatever is written in keynote. A single page here can give you the idea and the highlighted area what we are going to deal in the next style. It is the fixed ideas of Thuja. Friends, this particular mental symptom belongs to constitutional component of Thuja and physical component we are not dealing here, but we are dealing with psyche or mind, which has got the Kantian approach, will and understanding, emotion, intelligence and memory. This fifth sentence or PQR5 deals with fixed ideas as if a strange person were at his side, as if soul and body were separated, as if a living animal were in the abdomen, or of being under the influence of superior power. So this is a mental general and it belongs to illusion and hallucinations. So friends, we have understood there are predominant four delusional and hallucinational states are given. Number one, feels as if a strange person is on his side. Second, feels as if soul and body are separated. And third, feels as if a living animal is in his abdomen. And fourth is he feels that he is he is under the influence of superior power. And this is what we are going to deal here in this particular discussion. So clinically speaking, this particular hallucination comes with delusion of control. We can say this hallucination points to delusion of control. The exact match here what we see is under the influence of superior power, and if you try to understand what is the clinical significance this particular symptom has, it is a classic first rank symptom of schizophrenia. That is what is important. So let us elaborate. We are going to have the further discussion about schizophrenia, and this type of schizophrenia which we are dealing with this kind of a delusion being under control of superior power, schizophrenia of being under control of superior power. So here we are going to discuss in terms of the very first thing which we should know about what kind of this delusion can be defined as. So friends, we can define this delusion. It is a mental, schizophrenia is a mental disorder. And here a person believes that his thoughts, feelings and actions are controlled or influenced or interfered with by some external superior power. That is the core concept or idea is there of this particular type of schizophrenia. So let us go to psychopathology. In psychopathology, you will find that there is a disturbance in thought process and perception. There is a breakdown of boundaries between the self and external world. Person feels that his mind, thoughts, feelings, impulses or actions are controlled by some external agency. And there is a delusional belief of control, influence, interference, or domination by superior power. It can be a machine, or it can be a specific race, or there can be spirits who are controlling his mind. If you go by the chemical messengers in the brain, neurotransmitters, so modern knowledge tells us that this kind of psychopathology is associated with dopaminergic dysfunction and neurochemical imbalance. That is the basic cause here. Now we go to the next area, which is sign and symptoms. Here you will find the basic phenomena of this disease is delusion of control, and there is a influence which interferes or interference, or he is so buckled up and cannot resist, he has to comply, so phenomena of passivity is there. That is the classical feature here. The patient feels that thoughts are being put into his mind or they are taken out of his mind. He also believes that actions are performed by external power or machine, and there are hallucinations, especially the auditory, which are commanding voices or abusive voices. And there is a suspiciousness, fear of being controlled, and there is a social withdrawal, emotional blunting. These are the late symptoms, and ultimately patient has got poor concentration, disorganized thinking and speech. Well, friends, if we go for the diagnosis, you will find that there is a important aspect is the detailed case history and mental state examination. Presence of delusion of control and passivity phenomena seals the diagnosis in a way. Hallucination or thought insertion withdrawal is classical. Duration is very important, at least 6 months, and the active symptoms should be present for 1 month or more. Rule out at the same time organic causes through clinical evaluation and investigations. And this diagnosis criteria is as per the DSM-5 and ICD-10 or 11. 11 is now prevalent nowadays for schizophrenia. So let us go to the prognosis. What is the prognosis of this particular problem we have? So the prognosis is very variable, and it depends on early diagnosis and initiation of treatment and support, family support. With proper treatment, improvement in symptoms and functioning is quite possible. Many patients, they lead meaningful and productive life. The poor diagnosis is there if they are not treated properly and they do not follow up the medical advice. Early intervention gives better outcome. So whatever the treatment plans are available today, we'll try to see. So main therapy, allopathic, what kind of a treatment planning they have, we need to have the insight. So suddenly, if the patient comes with these medications, you should not stop the medicines, or even if you have some kind of a query, you should talk to your counterpart in the psychiatry, so you will be able to amicably have a transition where you can take over or you can supplement your homeopathic medicines. The main medicines are antipsychotics. They are atypical one are risperidone, olanzapine, quetiapine, amisulpride, aripiprazole, and clonazepam. Typical one are haloperidol, chlorpromazine, and these are the medicines They are not very commonly used. They are used in selective cases. Adjuvant therapies are, you will find patient may get antidepressant, anxiolytics, and mood stabilizers. A psychosocial intervention includes psychoeducation, CBT, cognitive behavior therapy, family therapy, social skill training and occupational therapy is important. Rehabilitation and vocational training are also important. General measures include a regular follow-up. Patient should adhere to medication. He should follow healthy lifestyle. And stress management is very important. Adequate sleep ensures remission. At the same time, when we are dealing with homeopathic medication, the most important medication is constitutional treatment. It is an individualized totality approach based on mental, emotional, and physical symptoms. Remedies they act on the root cause and help in restoring mental balance, it is believed. Commonly indicated simillimum medicines you will come across is anacardium oriental, where the delusions are very, very marked, and these delusions are being controlled and compelled. In case of stramonium, you will find the fear predominates, and there is a delusion of persecution and control by spirits. Hyoscyamus niger is also important. Here, patient is talkative, suspicious, jealous, and there is a delusion of control. Leucosis has delusion of being influenced, and there is a suspiciousness and jealousy very, very marked. Cuprum metallicum is also one of the important remedies we come across. Here we have impulses controlled by an external power. Then we come to the supportive care, which includes counseling or psychotherapy, family support therapy, healthy diet, regular routine. These are the things which help improve the mental well-being and quality of life. Let us go to the homeopathic core miasmatic component of this particular problem. So you will come across miasmatic cleavage. So there are certain markers, predominant psychotic markers. There is a well systematized delusion is present. Delusion of persecution and prosecution are present. Delusion of control and passivity is present. And there are fixed, hidden and suspicious nature. Mental rigidity and chronicity is present. So these particular markers guide us, and we perceive that this particular schizophrenia of being under control of superior power, which is a subtype of paranoid schizophrenia, is a common symptom for this particular area of diagnostics. So, miasmatically speaking, psychotic miasmatic background is very, very strong and predominant here. Sora is the underlying basic miasm, active miasm is psychosis, and we don't find here any destructive changes except that there is a fluctuation in the neurotransmitters. If you talk about Hahnemannian behavior classification, so you will come across and you will find paranoid schizophrenia belongs to axis of psychosomatic cluster disorders. Let us have a small note on the modern classification. Currently, we are dealing with this text of psychiatry from DSM-5 and ICD-11. This particular schizophrenia is supposed to be subtype of paranoid schizophrenia, but other schizophrenias are like catatonic or hebephrenic. These kind of things were previously predominant diagnosis was seen in DSM-4 and ICD-10, but now we do not follow this kind of a diagnostics, and clinicians they more have the emphasis on clinical type which are going to be presented in clinic like schizophrenia with predominant delusion control passivity, schizophrenia with religious delusions, or psychosis with paranoid features. Friends, differential diagnosis is also very, very important here. So some of the things which need to be seen into from the differential point of view: bipolar disorder where psychotic mania is present, or delusional disorder, persecutory type, schizoaffective disorder, substance induced psychosis, and severe dissociative states can also mimic similar features. Now we should be careful about the red flags where we have to go for the main therapy and homeopathy becomes secondary. So please remember, if command hallucinations are present, then the homeopathic should be considered as a secondary line of treatment and the modern medicine becomes the primary line. If there is a suicidal ideation is there, and if the violent aggressive behavior develops, there is a self severe neglect and catatonia develops and patient loses touch with reality, a complete loss with reality predicts poor outcome and should be treated primarily with modern medical assistance and secondarily with homeopathy. Now let us go to the course of illness, and here we find the episodic course where we find attacks with partial or full recovery are there. There is a continuous chronic course where symptoms they remain persistent. Residual states, there is a reduction in positive symptoms, persistence of negative symptoms like social withdrawal, poor motivation, emotional blunting, etc. Please remember, the carry home message is schizophrenia is a chronic but treatable disorder. Early diagnosis, proper treatment, and continuous support can bring about a significant improvement in the status of the patient. So, with this, friends, we come to the end of this particular journey. Thanks. Thank you very much for watching, and sharing is caring.